Dr. Jeff, and I want to welcome you to my website and thank you for visiting. And I want to introduce you to our Dr. Jeff video series called Ask Dr. Jeff. If you're a patient or a friend, welcome back to the site. I appreciate having you. For those of you who don't know me, my full name is Dr. Jeff Schabowski. I've been in practice since 1994 at Central Florida Wellness and Injury Centers. In this ongoing short video series called Ask Dr. Jeff, I'll be talking about staying pain-free and feeling great. And frankly, who wouldn't want to do that? If you have a question for me, you can submit it on our state-of-the-art website, orlandochiropractor.com. Questions on back pain, auto accidents, sports injuries, or even more general questions like, should I see a chiropractor even if I'm feeling great? Now the short answer to that is, of course you should. Think of a dental analogy. When you go to the dentist, you don't just go when your teeth are rotting and in pain. You go preventatively twice a year. It's the same thing for the spine and spinal health. I hope you will come back often. We're going to have information, blogs, articles, and of course, these videos called Ask Dr. Jeff. I look forward to seeing you, and remember, your back is our business. And now for today's Ask Dr. Jeff. Hello and welcome back to my Dr. Jeff video series. Today's topic, we're talking about why should someone even see a chiropractor when they have a car accident? Or better yet, I don't have any pain after a car accident. Why should I go to a chiropractor? I get this question all the time from patients, and it's interesting. When people get in a car accident and they have some pain, they typically will go to the emergency room or see their doctor. They'll be given prescriptions for anti-inflammatories, muscle relaxers, painkillers. And that's all good. It helps to control pain, swelling, inflammation, spasm. But really, is the spine really being checked? Chiropractors treat misalignments of the spine that can put subtle pressure on the nerves and affect the whole body. So many of these people who cover their pain initially with painkillers, muscle relaxers, and anti-inflammatories, once that pain kind of subsides a little bit, they still tend to have little problems with their spine, and left unchecked, they develop into big problems. The spine is a functional unit. It helps you to move, to bend, to twist. It protects your nervous system. And it's just that if nothing's broken or dislocated, many people are under the false sense of security that they're all better. And in fact, they're not. And many of my patients I've seen who had a car accident 6 months or a year ago, 2 years ago, 5 years ago, are still suffering the consequences when they come in to see me because they've never properly been checked. And proper means a full spinal assessment, looking at ranges of motion, functional ability of the spine, looking for subtle nerve interferences that can be affecting the body. So just covering your pain with a painkiller, covering your inflammation with an anti-inflammatory, relaxing muscles with a muscle relaxer, it doesn't cut it. It doesn't get you where you need to be. Sure, it's a great first step when you're in pain, but functionally, you got to look to correct the spine and check it. That's why it's important to see a chiropractor after a car accident. And I want you to remember, your back is our business.